Hello everyone and good afternoon. My name is Iringo Demeter and I'm part of the management team of INCATE, the incubator for antibacterial therapies in Europe. My today's presentation is about the efforts of European incubators to bridge the gap between innovative research and pharmaceutical companies' development activities, here in particular INCATE. So why are we all here? We are here because pathogen-associated infections cause 28% of the global disease burden, and 50% of these infections are due to bacterial infections. Whereas 7 pathogens, namely Streptococcus and SK pathogens, are mainly responsible. Death and disability from these 7 bacterial exceeds tuberculosis, malaria, HIV, and AIDS combined. So although bacterial infections are a huge part of the global disease burden, antibiotics development face a lot of issues. First is that the pipelines of antibiotics is almost inexistent comparing to immuno-oncology, as you can see here. And although immuno-oncology is just a subdivision of the whole oncology drug development field, the difference is still remarkable. And the second issue we are facing is due to market failure. Antibiotics are considered as commercially unattractive. So you can see here, compared to other disease treatments, antibiotics even have sometimes negative values in their development. And the reason, therefore, is the so-called antibiotic paradox. The challenges in R&D and the challenges in appropriate use lead to challenges in applying traditional economic models for antibiotics development. Hence, push and pull incentives are needed. So you probably heard about them already in a previous talk. But just to sum them up, push incentives are several multi-part initiatives that are seeking to spur innovation in antibiotic development. And pull incentives are policies to foster a viable and attractive innovation ecosystem by rewarding successful development and helping to overcome current market failures. INCATE, as an incubator whose purpose is perceived to accelerate research and innovation into viable businesses, contribute to this ecosystem as a push incentive. And this slide shows the current global AMR push funding landscape on the example of the development of therapeutics. So you can see INCATE covers from hit validation onward onto preclinical development, and INCATE accepts applications globally on a rolling base and supports all modalities in fight of AMR. So this is quite unique compared to other push fundings, which are on annual calls or have specific funding calls. I don't want to go too much into the detail about all these funding landscapes. I probably heard most of them. The more famous ones are CARB-X and PACE. It's a pathway of antimicrobial clinical efficacy, which focuses on early-stage antimicrobial drug and diagnostic projects. Others are, of course, in a later stage, like the AMR Action Fund, BADA, and also GARD-P. But INCATE is more than just funding. INCATE's mission is to help innovators to bridge the gap between research and investable companies. We do that with advice to align with market and medical needs. This can be R&D advice, business development advice, strategic advice. We also build an antimicrobial community we are quite proud of for a wide-ranging information exchange, including collaborative research, development, intellectual property, manufacturing, regulatory consultations, and supporting activities towards acquiring larger funds. We do this on various levels, like organizing events, as being a partner on the AMR conference, which will be in February next year, and also through connecting our portfolio ventures within INCATE or with our ecosystem, as I mentioned, with experts, KOLs, and potential partners and investors. And here our goals are first to replenish early antibacterial pipeline, quality support for technologies to reach the next development phase, expansion of the AMR community and network, and retention of the knowledge in the AMR field. And how do we do that? How can that be achieved? Well, INCATE is a partnership between academia and industry, was founded in 2021 from 4 academic member institutes the Swiss National Center for Competence in Research, then the Leibniz Institute for Natural Product Research and Infection Biology, HKI, at the University Basel, and also the DZIF, it's a German Center for Infection Research. The Technology Research Institute BioAS that just joined last year, the management team. And with the help of our industry partners, our ventures can get in contact with the pharma industry very early on to ensure and development according to medical and market needs. In addition, our industry partners sponsor the non-dilutive funding for selected ventures. Here we are especially thankful for Shionogi, with a long history to fight infectious diseases and ongoing commitment to the research and development of new antimicrobial therapies, supported INCATE from the beginning on. Dr. Hideki Maki, who has given us the opportunity to present here at the NIKKEI FT conference, is also a member of a selection committee. And INCATE is of course also supported by a number of supporting partners that operate in different areas and link INCATE to broader community, as the BEAM Alliance, the European AMR Innovation Hub for biotech companies, GARP, Global Antibiotic Research and Development Partnership, and various others working in being experts in IP, manufacturing, regulatory, and many others. So, how do we support our ventures? So, advice and communities of course open for everybody in the MR field. Academic groups with plans to spin off from university and young startups are eligible to apply for non-dilutive funding in a two-stage process. So you can see stage 1, we offer 10,000 euros, which is used for coaching, defining milestones, refining cases, or conducting first professional consulting for market research, regulatory, IP, and CMC activities. In stage 2, our ventures receive 250,000 euros, which is used usually for incorporation, gathering key data, and building a business case, which bring the ventures to the position to apply for follow-up funding, e.g. CARB-X, CARB-P, etc., or to simply just to de-risk the project to further attract investors. So, although we receive most proposals from Europe, we see us as a global active incubator supporting research in AMR worldwide. We do not have any Japanese ventures in our portfolio yet, so we would be very happy to receive proposals from researchers from Japan in the future. And we are also, of course, open, as I already mentioned, to all kinds of modalities, covering the area from prevention, as vaccines, to treatment, prophylaxis, from direct-acting agents as small molecules and antimicrobial peptides to alternative approaches as bacteriophages and phage products as endolysines, but also biologics and indirect acting therapies as antivirulence compounds, immunomodulators, and potentiators. So also here you can see our portfolio supporting all kinds of modalities. We have approximately 50% direct acting and alternative approaches, which I already mentioned is very unique because most other organizations focus on direct acting antibiotics. But we think that alternative approaches are really necessary for future innovative therapies. And you can also see we have already awarded 2 stage 2 awards. One is to Xirexza and Invitris. I'm going to talk about Invitris a bit on the next slide. But just Xirexza is a US-Singapore company. They received stage 1 in Q1 2023 and stage 2 this year in January. They have a new class with new MOA, small molecules targeting gram-negatives. And INCATE helped them with R&D advice plus network. And they are now supported by PACE and CARB-X funding. And another success story is CC Bio, a UK-based endolysine company with stage 1 in funding in Q3 2022. And there were the funding were used to help to recruit key personnel. And in March this year, they had a trade sale to Precious Biotics Therapeutics. Here I would like to present you one of our success stories. It's Invitris, a Munich-based phage platform technology company. who received, started with first contact was September 2021, and they received stage 1 funding in January 2022 and stage 2 funding in February 2023. We helped them in lots of ways besides the funding. So their feedback was that we were actually the first structured advice they received in AMR community. We helped them a lot to understand how fundamental CMC is. We connected them to an expert here. They are still working with him. And also to better understand the antimicrobial commercial landscape, which helped them in a later period to pivot their business models and get in a stronger position for partnering. We also helped them in the process of the spin-off of the university. So by supporting in the negotiation terms and also to understand the licensing needs of a startup. They used their stage 1 funding for, to connect to the CMC expert and to get an overview on the CMC task and getting incorporated. And the stage 2 funding was basically used for as a bridge funding until they could raise their own capital through the Y Combinator, which is a combinator in the US, incubator in the US. Focusing on all kind of startups. So one of the more famous ones are like Airbnb and Dropbox. Now they are fully operational in the top biotech startup campus in Munich, IZB, and they have raised over 1.5 million in seed funding and revenues already, and are currently in negotiations with multiple deals with a total deal value of 1 million euro. So INCATE supports research in AMR worldwide. So if you would like to get involved in our activities, please sign up for a newsletter at incate.net. You can also follow us on our LinkedIn page for updates and news in the global AMR field. And we are, just to mention it again, we are accepting applications from researchers and ventures worldwide on a rolling basis. So you can also get in contact with us through our website. Maybe inviting you to the upcoming events. One is our next Entrepreneurs Club. It will be about, it's never too early to speak to regulator. So I think interesting for everyone. And next is we will be presented at the AMR conference in February in Basel, where we're also hosting a poster session together with the Beam Alliance, and we will also have a startup pitch event. So we would be really delighted to receive poster applications by Japanese researchers as well, and informations about deadlines you can receive on our LinkedIn page too, or through our newsletter. So having said that, I hope you enjoyed the presentation around INCATE, the incubator for antibacterial therapies, and thank you so much for your attention. I also would like to express our gratitude that we were invited to present here, and would like to hand over to Dr. Hideki Maki, representing Shionogi, who will answer your questions from the audience. Thank you so much, and hope to see you at the AMR conference in Basel next year. Bye.